Hello, this
Might
is
have to come
Roxanne
back.
Foster. Can you see me?
She's on
Zoom.
Zoom.
Darn,
Can everyone hear me? Okay?
I know it.
Can you hear me or no?
Somebody's talking. Talking up there? Yeah.
If you can
Is
hear
she
me, wave
muted,
your
or we just
hand.
we can't-
She has to unmute herself.
Okay,
I'm
You hold up a
unmuted.
sign, unmute yourself.
She can hear us.
she can hear us.
I'm unmuted.
Oh, she's unmuted.
Can you hear me? Can
Can you
anyone
hear
hear
us?
me? I can hear you.
Great.
Now we can hear you.
Barely.
We're ready for you.
Try that one more time.
Okay, can you, I just want to make sure everyone can hear me.
Good. That's good.
Okay, great. Well, hello, everyone, and good to see you, even if it is virtually. This is Roxanne Foster with the Michigan Department of Treasury. I don't know if I've had an opportunity to meet all of you, but I appreciate working with the county and all of the staff that works hard to prepare for the financial audit every year. I'll be talking about the fiscal year 2020, so September 20 audit. Does anyone have any questions before we get started or areas they'd like to focus on?
I'd like to focus on our weaknesses, please.
Okay, sure.
And what we're doing to make it better.
Okay, absolutely. So maybe I'll just quickly go through kind of a comparison of how the county's doing financially between last year and this year, and then we can focus on the weaknesses. And if you'd like me to stop and go into more detail, please just let me know. I have a printed copy of the audit in front of me, and I understand that you have received copies of the audit as well. So we will go from there, and I'll kind of refer by page number in the audit so that we can all be on the same page. So the very first thing quickly here is the opinion of the audit, and that's the crux of why we're even here. So we did issue a clean opinion on the county's audit, and that is in our opinion letter, and that's probably the third page in. It's before the page numbers even start. So that's just the first most important thing, that the county received a clean audit. If you want to turn to page 3, this will give you comparison of the governmental activities within the county. So you can tell, you know, and I know we all know that 2020 was kind of a year like no other, that I know we're all aware of that. So, you know, there were some financial implications in a lot of different areas. So when I discuss these increases or decreases, you know, take that with the context of, you know, 2020 was, you know, a different year for everyone in different ways. So on page 3, you can see that the net position of the governmental activities did decrease by 366,000. Probably the biggest, and this is kind of like a balance sheet, the assets and liabilities of the county. There was a moderate decrease there. On the next page, you can see a similar comparison for the business type activities. And in that case, there was an increase of 400,000. So the governmental activities went down a little bit and the business type activities went up a little bit. For the revenues and expenditures on page 5, you can see that the ending net position again went down that 366,000 between the 2 years. And that has to do, you know, again, with the revenues and the expenditures. Revenues did go down, but so did expenditures. So that is on page 5. If we want to skip over to, let's go to page number 16, and this is where you're probably most likely most comfortable and most familiar with dealing with the general fund. So on page 16, this is a summary of how the general fund ended up at the end of fiscal year 2020. So there was, you know, 11 million in revenues, 11.6 million in expenditures, and then there were some other financing sources, and this is where the transfers and installment purchase and lease proceeds are listed. So in this fiscal year, there was an increase in the general fund balance of $246,000 for the general fund. And you can see this listing has the major funds, so the Michigan Indigent Defense, the Community Development escrow and the senior services are located here on page 16. And the senior services, I'd want to highlight, in the prior year, there was a small deficit in that fund, and it is now out of deficit and has a fund balance of $116,000. So that's good to note there. And again, if you would like me to stop and discuss anything else in more detail, please don't hesitate. I will pop over to page 37 a little bit further in, and this is within the footnotes to the financial statements. And this is an area that, is a challenge for the county, just with the sheer volume of transactions going in and out. But this on page 37, note B, shows the budget variances at the end of the fiscal year. So there were several variances with the budget. So the actual expenditures were more than what the final budget was. And some of those are, I know $366 is not a lot of money, but in this regard, we must notate every variance over $1. So that's why you see some that, $366 generally wouldn't, pop a question, but in this case, we have to list all variances over $1. So that's on page 37.
How does that compare with previous years?
I do think that it is better than last year. I think the county has made progress continually. One area that I would recommend to continue to focus on is if large capital purchases are made that were not originally budgeted, those need to be amended. So, for example, the capital outlay in the courthouse, there was not a budgeted amount, and then it turned out that there were some pretty significant expenditures. And some of that has to do with, there might have been some adjustments along the way, but just to keep in mind that if there's large capital purchases within the year, those need to be reflected in the budget as well.
Okay.
Let's see, page 43 within the footnotes. This is just a summary of the capital assets in the governmental funds of the county. So this shows the amount of, land, construction in progress, buildings, vehicles, furniture, and equipment. And this is a summary. Can you hear me okay?
Yes.
Yes.
Oh, okay. Sorry, I didn't catch that. So that's one area to look at. It looks like there was a net decrease, but that's pretty much just because of the accumulated depreciation. We can pop over to page 85, and this is a summary of the pension liabilities for the county. I know that's generally something that the commissioners focus on as well. So on page 85, on the first column, that would be on the left, as of the most recent actuarial valuation, you can see that the total pension liability is 25.8 million. The planned fiduciary net position, so that's how much the is kind of in the savings account of the county, so to speak, within the pension, is 18.2 million. So the employer net pension liability, so that's the amount that still needs to be, contributions and things still need to go in, is at 7 million. So the bottom line there, though, is that the county is at a 70% funding percentage for the pension. And you can tell going to the right there, how that percentage has fluctuated over the years when they reevaluate the liability. There is a similar graph for the road commission and the transit if you're so inclined. And also on page 87, so just a couple pages farther, you can see a similar breakdown for the OPEB or the other benefits, the retiree health care for the county. And the county is on a pay-as-you-go system for the retiree health care. So you can see, actually, sorry, page 88, and that might not have, the page number might have been cut off on your end. It somehow got cut off on my end, but it is page 88. for the retiree healthcare. That funding percentage, just because of the way the county set up, is at 0%. It's kind of a pay-as-you-go system that you're familiar with there. So that if you'd want to look further. Next, I will jump to the schedule of findings and question costs, and that is on page 123. And on page 123 is the summary that we send to the federal government. So because the county had more than $750,000 of federal expenditures for the year, there was a single audit. So there is a summary here on page 123. Again, it shows there was an unmodified opinion, and it lists the federal programs that were tested as major programs. So you can tell that the Coronavirus Relief Fund, the Medicaid cluster, and the aging cluster were specifically tested in more detail for that federal audit. And then farther, we will go over then the audit findings for the county, and in relation to the federal awards, there were no audit findings for the federal grants, which is a good thing. If you have questions or would like to look further on the amount of federal funds that the county received, the schedule of expenditures of federal awards is back a couple pages on 114. This lists all of the federal dollars that the county received over the year. And the total at the bottom there, it was $1.3 million, which is a little bit more than in prior years. But there was, some additional federal funding for the coronavirus relief and so forth. So if you have questions on those federal dollars, that's on page 114. And I would expect going forward that number will increase pretty significantly with the American Recovery Act dollars coming through. So I guess to focus on the weaknesses, that those start on page 124. And are there any questions or comments before we go there? Okay, so the first one.
We got a question in the back. Tom?
Okay.
Our treasurer indicated that there were funds set aside earlier this morning. Are those listed on page 16 that the county is holding back because of the lawsuit?
Okay, you're talking about, let me see if I can swing to that page quickly here. You refer to page 16.
Yeah, there forfeitures.
Okay, so forfeitures are part of the business type activities. So you can see details of those on page 18 and 19. So the tax forfeiture fund is an enterprise fund. So in terms of funds set aside.
It'd be for those lawsuits.
Yeah, I'm trying to remember if that was made before September 30, 2020, or if that was after. These reports only show activity through September 30th, 2020.
There be funds though being set aside every year since that suit is over 2 years old.
Oh, that's a good question. I'm not seeing that right here, but I can do some more research within the details of it. Can I get back to you on that?
Yes, certainly. Thank you.
Okay, sure. And it was Tom?
Yes.
Okay, thanks, Tom. I'm just making a note here. Pardon me for a minute here. Okay, I will get back to the group on that as soon as possible. To go back to the audit findings, if you want to flip to 124, this first finding we do consider a material weakness. That's finding 2020-001. And that is a reoccurring issue. It has continued to get better, but there's still some improvements that need to be made within the accounting for the capital assets. And in this case, we are recommending that especially departments and department heads become involved to do some inventorying and making sure that the capital assets are appropriate, listed appropriately on the capital asset listing, and that they are recorded in the proper account number when they are purchased. Also to make sure if the county will continue to use the module within BSNA for the capital assets, that that listing is, agrees to the listing that's been audited throughout. So there's some work to do in that area. The second issue on page 125, that's the preparation of the financial statements in accordance with generally accepted accounting principles. And again, this is a repeat finding, but it's one that is very common within local units of government. And this is really just that as auditors, we assist in the preparation of the financial statements and not just audit them. So in this issue, we are required to disclose, we assist in putting the footnotes together and all of the reports, which is, again, is very common. We just have to notate it, instead of being handed, all of the financial statements put together and we just audit them. We assist in the preparation of the financial statements. So that's kind of a disclosure type finding there.
I have a question.
Sure.
Yeah, your recommendation, that we, look at the cost versus benefit of establishing internal controls over the preparation of financial statements in accordance with GAAP. Does our solution, is that satisfactory to the state? It says that the board will designate a responsible county official to carefully review the draft financial statements, including the notes, prior to approving them and accepting responsibility for their content and presentation. Will that take care of that significant issue?
Yes, it does take care of it. Again, we have to disclose that we assist in the preparation, but we are satisfied as the state with that response.
Okay.
It's more, it just has to be disclosed.
And Roxanne, because you prepare our financial statements, that is going to be a weakness that is put in our county audit each year.
Correct.
Okay, thank you.
Yes. Yep.
So you're still looking for someone inside to prepare the financial statements in order to get rid of that weakness. Is that correct?
Either inside or hire. I mean, you could have another CPA or something prepare those. Some have a CPA on a consulting basis do that. That's, I think, where the cost benefit scenario kind of comes in.
Yeah.
The next item on page 126, that is finding 2020-3. And again, this kind of disclosure type finding a non-compliance with state statute. And this is due to a couple of other smaller deficits that are in some funds as of September 30th, 2020. One is in the child care probate fund of 11,000, and one is in the lake level fund of 11,800. Coincidentally, similar numbers there, but I believe that those should be taken care of pretty quickly, but they were negative at the end of the fiscal year and are required to be disclosed there.
They are already taken care of.
Okay, great.
Good. Thank you.
The item on page 127, that is finding 2020-4. And this is what I kind of had mentioned earlier in the footnotes to the financial statements. This is, again, the disclosure of the expenditures in excess of appropriation. So those budget overages, you can see on page 128, that same listing that was in the footnotes to the financial statements. And then on page 129, kind of middle of the page, you can see that it was reported that there were no federal findings regarding the federal awards for the county. And then the next section at section 4, this is just a summary of the audit findings from the prior year. So you can tell some of these were repeated, like the capital assets, the preparation of the financial statements. There was that senior services deficit that's been eliminated, and then the budget finding that we see quite commonly. So that's where we're at with the deficiencies. Are there any questions or comments, or can I discuss anything further on that?
What do you recommend on the budget? Should we do before our year end, should we do another budget to?
Possibly
Take it-
amend it again before?
Yeah.
Yeah, that's always an option. It's difficult, I've heard the analogy, it's like herding cats. There are occasions where, invoices come in after the fiscal year that have to be recorded back into that fiscal year. So there always is that bit of a risk if a department isn't familiar with every invoice that should be coming in. But having amendments right before the end of the fiscal year would definitely help in that regard.
Okay. Any other questions?
Thank you very much.
You're
Very
welcome. I
helpful.
appreciate all of the coordination that Tracy and Jenny and Lori go through, working with us. And especially this year, it was a remote audit, which is not our preference, but it is, kind of where we're at right now. Hopefully we'll be back in person soon, but I appreciate everyone's work and getting us all the information that we need. And it was on a timely basis. I will do some more digging with the question that Tom had. Can I transmit the information through Tracy, or is there a way
Yep.
that I could communicate back to Tom?
That works.
Okay, sounds good. I'll work
Tracy.
on that. If you have any questions, most people there have my contact information, and please don't hesitate to get with me any questions.
Thank you, Roxanne.
Thank you.
Okay,
Great
thank
work.
you. Take care.
Yeah.
Thank you.
Jennifer Martin, are you out there?
Jennifer?
I am out here. Yes. How are you
Great.
guys?
Hi.
Good. Yourself?
I'm doing good.
Good.
I normally have my camera on. Today I'm going to leave it off because I'm having some struggles with pulling my screen share for some reason. So I figured you guys, the more important part is I wanted to pull up some of these pieces and reference as you go through them. And thank you, Tracy, for handing those out.
Jennifer, I didn't do the bigger
That's fine.
pamphlets, just the smaller ones.
So just, okay, so the main one that I'm gonna go through, you
Thank you.
guys, is the agenda. And I think that was 6 pages long. Is that what you handed out, Tracy?
Yep.
Perfect, okay. So no renewal right now, you guys. I don't have the actual renewal in hand, although I will continue to pray to those insurance fairies that we see something similar from what we've seen last year with the negative increase. I will say we've seen some very good renewals that have come through, and I think it's a result of still that COVID lag of a lot of members not seeking care, whether that's a good thing or a bad thing, but I have seen that it has had a positive effect on renewal rates. And so hopefully we'll see another good renewal for this upcoming plan year. And I expect to see that probably in the next 30 to 45 days and can give you a better idea of what we're facing there. When I do look through utilization, so now is the time prior to that renewal coming in that I like to really get knee deep into your utilization to get a feel for what's going on within the group. That way, when it does come, especially if it's a higher one, I'm kind of anticipating it based upon what I've seen. Or if I'm seeing that, utilization is not that high and you guys get hit with a higher one, I can quickly jump in and say, okay, this does not make sense. I'm not seeing a whole lot going on within this group. And so right now I call this kind of that pre-renewal update where I like to report back on what I seen last year and how it performed. I know towards the end of the year, we talk about that, but I never have the year-to-date info. So I want to just touch on that real quick and then give you an idea of year-to-date now where we're at and what I'm seeing. with just some of the performances. So you guys can have a full update there. So do you guys want me to pull the agenda up on the screen as well?
I don't think we beat.
No, we're
No, just
good.
go ahead and go through it.
Good.
Okay. So on the first page, if you look, you're going to see towards the top, the 2021 plan year overview utilization. And so this is again looking at last year's data. So this gives you kind of an idea of where we fell once we got that full, the full claims that had came through. And so you'll see
That's nice.
premium savings
That's
is
good.
528,000. And, oh, actually, sorry, guys, this is year to date. So this is this year's plan year. So it's from October 1st through March 31st. You'll see that we're at 119,000. And when I estimate that at an annual number, it's at 238,000, which we're down from last year by about 173 if we were to continue down that mark. So that's good news. That again tells me that you know, they're not having the care that they were having before, or we just have had a significant number of claims fall off. But the plan itself under the HRA side is performing excellent, and hopefully, you know, we'll see that reflected in the renewal as well. And basically, for those of you that are kind of wondering, okay, what does this mean? It means we're buying that 5,000 deductible. So we buy that higher deductible plan to get the premium down. So think your auto insurance. If we increase the deductible, obviously your premium goes down. It's the same thing that we're doing here with healthcare with the HRA. We're buying a higher deductible, but the employees are not actually paying that 5,000. So the premium goes down by 528,000. But then out of that premium savings, we reimburse back to get them to the deductible level that's within the contract. So we never want to have that utilization exceed 528,000. Otherwise, we might as well just buy that benefit directly from the carrier. So right now, year-to-date savings is 409. We're projected to be about 290. So what that means is if we were not doing an HRA, we would be paying $290,000 more to Blue Cross or BCN to have them manage the exact same plan. So as you can see below, year after year, it's consistently worked well for you guys. We've been doing this since 2009, and we keep a track of those savings, and we're a little over $12 million at this point. So definitely a smart way to manage your guys' benefits the way your performance runs.
Good.
Going down a little further, you're going to see emergency room utilization. So this is taken in more of a full year snapshot. So I wanted to look and see kind of how this is trending from, and this data is from April of 2020 through March of 2021. You guys had 26 ER visits, which is trending upward a little bit, not a ton, by about 1.94%. So nothing to be concerned about for the size of your group. That's pretty average. And then you can kind of see the leading ER diagnosis as well as the highest paid. Just again, it's nice to get an idea of some of this data. So that way, when the renewal does come in, especially if we're being faced with a higher increase, you kind of want to know why. And so that's why it's nice to look at some of this data. But at this point, this piece of it, nothing really alarms me. The one that does cause me a little bit of concern is you'll see the contracts exceeding the attachment point. And so that's that 100,000. We've had 6 contracts that have exceeded that 100,000. And that's going to be reflective in this year's renewal. So that is one piece that does create a little concern for me as far as what we're going to see. I don't think you guys are going to get anything huge. But I don't think we're going to see a negative this year. because of that right there. So, and that's really, you know, it could be open heart surgery or a major, you know, maybe there was premature twins or something like that. So I've got some of that data down below that will tie into this, but those are typically those big claims, the big surgeries that have occurred, and 6 is pretty high for your group size. So we average usually between 2 and 3, just to kind of give you an idea. Okay, so for the Arrow RX overview. So if you guys recall, we're now in year 2 of moving the prescriptions from Blue Cross over to our Arrow managed pharmacy program. And this is now a self-insured program. So kind of similar to what we're doing on the medical, but we're more of a hybrid here. We're purely self-funded. So it's important we're managing these drug claims. And if you recall from when we initially rolled this out, we work with a lot of our partner international pharmacies. We're constantly looking at some of those higher costing drugs to find a solution for that member, not to change their drug. So that's what's the most important. We don't have the prior authorization or step therapy. We want them to get their drug. We just want to make sure that we're having that drug dispensed at the most affordable rate. And so if it's a prescription that's over $5,000 and they're trying to push it through at the pharmacy, it's going to trigger us, and we're going to connect with that member to either see, is there a coupon available? Is there patient assistance that they can be eligible for? Or is that drug something we can obtain at one of our international pharmacies for a significant lesser amount? And so when we look at the actual premium spend from Blues to Arrow last year, year to date, for that full year, we were $64,000 just in premium alone down. So that's great that we were able to see that savings. However, underneath that, you'll see an asterisk of 74,000 was diverted over to the international pharmacy program. So that's $74,000 that was not even part of the equation. It's kind of hard to quantify that, but what I can say is your utilization would have been up additional 74,000 and it would have rolled into your renewal, creating probably an even larger savings if that was shown. Those members, we were able to move over to that international program, and they also did not have to pay a copay at all. So they're getting their drugs for free. Many of them are continuing to obtain those drugs today. So it depends on what they're on. And then we continue to evaluate and add more as it makes sense. So currently from October 2020, the beginning of this year's plan year through current March 2021, we've paid out $130,000 in drug spend, and we're projecting to be about $261,000, which is really close to last year. So I don't anticipate any type of a huge spike in your drugs, which is excellent from the being able to manage those costs. That's not typical. Usually prescriptions, it's a constant increase going up. So I'm going to go down a little to maybe make a little more sense of some of this. If you flip to the next page, let's look at, so under generic optimization program, you guys see that? Okay, so if you look under there, I'm going to come back to that little grid, but you'll see a list of prescriptions towards the bottom of that page, starting with Victoza, ending with a highlight of $74,000. So this is part of the international work that we do for your group. So these are all the prescriptions. This is specific for Clare County. These are all the high cost prescriptions that your members are on. And what they were costing, and that was hitting your utilization with blues and having a tremendous effect on your renewal. And what they are costing now as a result of us working with that member agreeing also in some cases, if it's a non-specialty drug, to go international. So under some of Plan Pay Copay, you'll see 0. That's because the member doesn't have to pay anything. So they're getting their Geneva, they're getting their Trulicity, their Victoza, they're getting these drugs for free as a result of getting it shipped to them from our international pharmacy. So Victoza, that first one as an example, that drug is costing or was costing $22,000 on the plan. Now it's costing $10,000. So less than half to be able to get it from an international pharmacy, and it's the same exact drug. And so this is where you guys really are seeing some savings from where we'd be at today if we were still with blues on the drug side of things. So it's a pretty big, you can see spread between how we can obtain these drugs for so much cheaper. And I'm just going to stop there. So do you guys have any questions?
Very encouraging.
It is. It's very, you know, this piece has made, I've been doing this for 22 years, and this, having our pharmacy department has really brought a lot of excitement to my job. Not because, you know, I want to deliver a 20% increase, but for many years, we were going through a period where it's like I was delivering these increases with not a lot of solution, and banging my head against the wall with what more can we do? And so now being able to develop a program like this and still be able to give the members the same drug they're getting today and not take from their pocket, because these members were paying for these drugs before, in some cases, a pretty significant copay. So not only can we give it to them for free as a result of getting such a great cost internationally, but we're also reducing the plan spend for the group too. So it's really a win-win. And I don't know if anybody in the room is on one of the internationals and taking advantage of it. I know I am personally, and it's a really a unique, cool program. So my son's on a couple of inhalers even, and we get them, those are shipped in through Canada for us. And I don't have to pay anything where I would have been paying $80 a month on my plan right at the pharmacy.
And
so now going back up, we also have what's called a generic optimization program. And so this, I think, did create a little bit of confusion in the beginning, but it's a good thing that we have this in place. And this is that Med Tipster card. And so for those that want to take advantage of this, they can look and see, do they have a generic drug that they can obtain for free or for $5? And they can go on and pull the pharmacy list, which you guys have some in your area. And as long as they go to that specific pharmacy and obtain that generic drug, then they can get it for free or for $5 at most. So we've had for 2019, this one runs calendar year rather than plan year, the data on the report was, but 382 total claims. So that's drugs filled. And part of what the county paid was $4,941. If those members were not using this, those claims would have cost an additional $15,000. So it's just another layer to create that savings for these generic drugs. And then 2020, so this is year to date. So we don't have a full 12-month data here, but you can also see that number as well. Now kind of I'm gonna go back up again to the AeroRx plan cost summary. So this just breaks it down by month. This is something that Tracy sees that we're sending over, showing obviously they're getting some big bills that are coming through. And I know in the very beginning there was some questions. I mean, you don't just get a $15,000 bill and not question it and think, oh my gosh, what did we do? So what we do is we keep track of everything to be able to make sure that the savings is there. So obviously the Blue Cross bill is significantly lower as well. And we're keeping track of that to determine the actual savings.
Jennifer?
I won't go through this month by month, but at least you can get an idea. Yes.
Just to point out to the board, I was sharing this with Jeff. Our health ACH reimbursement line, which is normally at 300,000 by the time we're at the end of the year. We're over halfway through and we're at 112 right now. So 112,000. So, and I pointed this out to Jenny, we don't want to touch that line. We want to leave it right where it's at, because we don't know what's causing that. And when I talked to Jennifer, a lot of that was utilization, some things that people just haven't been doing because of COVID. So we're going to keep an eye on that. And if there are any funds left over from that, those funds will be able to be rolled back into the fund balance.
Great.
If not, they are there for that reason.
Okay, great.
Yep, I think it's a couple of things. I think it's one, like I said, and like you just said, Tracy, you know, we've had a slower year with utilization naturally because of the restrictions with COVID. But I think you guys are starting now to feel the full effect of Aero as well. So you're starting to see that savings, but I think it is good, you know, keep the anticipation of what that would be at a higher amount. I think you're going to see that savings for sure, but I think it makes sense just because you never know. I like to have a couple of years that are at that suppressed amount before a board starts to lower what that budget is in that account. Okay, so now let's see, let me make sure I covered. We're gonna go on to page, I think it's page 3. And it says COVID-19 medical claims dashboard. So this, I did include some attachments, but unfortunately the email I noticed did not go through last minute because of the HRA tracking. So I pulled all of this on the agenda. So I don't know if Tracy was able to print all of it out, but there is some additional attachments that have the more of this data or a cleaner look of this, but for now we'll look at it this way. So she can just forward that email to you, might be the easiest way to open the attachments. But what we're receiving from Blues now is a COVID dashboard that shows us the claim count specifically for your group. And obviously with COVID being, you know, such a important or discussed topic in our world today, I think it's important for us to have the discussion to see, okay, how is this affecting us specifically at Clare County and maybe our medical utilization? Or, you know, how is this affecting, obviously with HIPAA, we can't always know who's been diagnosed or have a big global picture of how many have been diagnosed. So this is going to give us some of that high level statistical data that we can have an idea of what's going on here. So from April 1st through March 31st. So what I did is I grabbed a full year look. And like I said, we are getting this on a monthly basis. And I talked to Tracy last week, and it's something I'm going to start sending her as well. Not sure that there's anything that you're going to do with it, but if you ever do, you know, want to know where you guys are at in a specific month, you're more than welcome to either reach out to her or me, because we'll start forwarding those on. And then as a report, I'll include those at a much broader level. So we had 130 patients. So keep in mind, that's not just employees, that would be dependents, spouses as well, that had a COVID-19 lab or diagnosis. So it doesn't mean that they went in and had COVID, but they went in and maybe were tested for COVID because they had COVID symptoms. 71 were suspected to have COVID, and 13 were confirmed. So that is, again, you know, maybe some of that data was not reported back. Maybe the member never actually got their test done, and they should have, but they didn't. So that's where they would fall into that suspected. Clare County paid $47,000 for COVID lab diagnosis for a total claim count of 259. So I point that out because, you know, in the media today, everything says COVID is free. And it makes it look as though maybe on the government level or federal level, they're paying for all of this. But I think it's important for us to realize that you guys are paying for a big chunk of this as well. So there's grants and different things that by all means that we're gonna work to take advantage of, or those dollars are coming through your filings. But you are paying for a lot of these services. So that is kind of tied to that. If you look, it looks like the highest by payment is the COVID labs or the inpatient facility. So we had, it looks like one claim. So one member must have been in inpatient at 23,000. We've had some ER visits, but the highest count was just members going in and getting that lab work done. And then we also had the vaccine first and second dose as well. So you can see that claim count. Now, I did check on this because I know we've had 2 members that had the single dose vaccination, and 2 things, either it's a lag to the reporting, or I found out in some cases they may not report it at all. So if it does not get reported to Blues, then obviously it's not going to show up. But for the most part, this gives a nice look as far as what's going on. Who's using the telehealth services? Now this is separate. Blues came out with free telehealth through June of last year. There's now a copay tied to it. So this is separate from MD Live, and I'll go into that. But it looks like we had some members use that as well. And then to the far right, you're going to see some of the different providers as well.
So Jennifer, that $47,000, COVID grants. So is there something showing that Clare County paid into that so that we could charge that back to any of our grant funds or our American Relief Plan or those types of things?
So I included the American Relief webinar that we did last month, Tracy, and it's got a lot of information. I included it in that email.
Okay.
In there as far as the deadlines and stuff. And I know you asked this of me already, and I did put this out to our legal team, and that's what I got back was the webinar stuff. So I don't have a clear answer for you yet, but I'm working on it. I was going to just go through that material myself too to see if it was clear in there. I know the deadlines are not up yet. I think it was September of this year. I think this is the report that you need to be able to claim some of those dollars. But again, I'll confirm back with you as soon as I have a better answer, because what I got was more here. Here's the webinar. So I just need to narrow down and answer a little bit better.
All right, great.
So far, though, this is the only thing we have received. So I don't know that there's going to be anything different. So it's got to be these reports. And I'm assuming that's why they're releasing them on a monthly basis. Now, we did have some updates from Blue Cross recently that had some really good slides in it. So I thought I would share those as well. And the full slide deck is in the email as well, if anybody is curious on looking at this a little more in depth. But looking at Blues, the the complete commercial book for Blue Cross and the testing count. And this is from March of 2020 through May 10th. You can see some of those testing counts as well. So this one here is not specific to Clare County. This is specific to the entire Blues book. And then if you go down, you're going to see more specific to Michigan. So it's got the US, but then you can see also specific to Michigan, and then the vaccines and the distribution there as well. So again, just food for thought, just something to be aware of. Obviously, nothing you need to do, just more of an update for you guys. So moving on, dental, vision, life. This is just kind of part of the start of my renewal agenda. So I have this on here. There's really no update here other than IMED. Obviously, there's no increase there. I told Tracy last week, one thing that I am looking at are I'm going to be price shopping both the dental and the life this year, especially the dental. I know year after year, the group, the committee has asked for a richer benefit for dental, but yet we've never made that switch, I think, because the rates were always, it was just too much of an increase to be able to enhance it. I had a great discussion with MetLife a month ago, and they have a new program out where if we were to move over to them, so I got to see where the rates fall first, but if there's a savings there, they'll automatically apply an additional $1,000 map to the max. So it would be an easy way to be able to increase their annual max without having to increase to the premium. So my goal is to try to get the rates more of a rate match or even a savings with a richer benefit. We'll see if I'm successful or not, but that's what I'm going to go for. That I should have, I'll have that information when we meet next and when I have your full renewal. MD Live, so this we've had in 2020, 32 visits, 4 visits year to date for 2021. We have 148 members that are activated. That means they went in, they filled out their questionnaire, their health questionnaire, and they're good to go to use should they need it. I would like to see higher participation here. I don't feel this is great. So I want to do a better job at educating the members and reminding them of this benefit. I don't know if they're forgetting about it, especially today. Telemedicine has become more and more accepted after what we've just went through with COVID. So I think it's important that we, again, remind them that, you know, part of your county benefits, you've got this great program where you can speak to a physician 24/7 and you do not have a copay to use it. Obviously, if it's, you know, for something more major, we want them to see their doctor, but for the simple head colds or, you know, sinus infections, ear infections, things like that, typically you can work with a MD Live doctor and they can call that script in for you and they're going to save some money. And then you guys are going to save some money on the plan as well, which in the end goes down to them too, because we can save money at a group level. It's saving them money at a cost share level. So that just kind of bullets out some of the top diagnoses that they were calling in for. So the flu, sinusitis, urinary tract infections, allergic cough, those are all the things we want them to be using it for. We just want to see a greater participation. So part of my commitment is to make sure we're getting out more of the flyers for you guys to distribute to the employees as another reminder that this is out there, just to really put it in their face to help them get using this again. And then I do have also just some, this is some utilization data towards the bottom again too on the plan. So this all drives into your renewal, your upcoming renewal. Another piece outside of the MD Live, you'll see the health maintenance exams. I put some smiley and sad faces on here. This is another area that I'm going to work with our wellness team on because I'd like them to really push this year those health maintenance exams. So we need to make sure the members are getting these exams because right now I'm not seeing a lot of them are, and it's free. So if we can be a little more proactive and get these screenings done, in the end, obviously they're going to be able to lead a healthier lifestyle, but also it's going to help on the claims end too, if we can prevent, you know, something bigger from happening. And then towards the bottom, you know, I threw on PA 152 employee cost share, just so it's not anything I need a motion for, obviously, because I don't even have your renewal. But something maybe that you guys can start thinking about, discussing. Are we going to leave the cost share the same this year? Obviously, you guys probably want to know what the renewal looks like before making this decision, but it's something that can be more top of mind for when that renewal does come in. Because we will need to make a motion come that time on what you guys want to do there. And then we do have monthly webinars as well. And so I don't know if you guys are aware of that, and I can get the calendar over and distributed to you guys, but you're more than welcome to participate in those if you would like. Some of the topics may not be quite as relevant for you and some may. So I know that the last one that we had just did was the American, the Family First Coronavirus Relief Act. So that kind of went through the tax credits that were extended, the COBRA subsidy, the dependent care. It kind of went through all of that. And that's the webinar that I attached. And you can actually even listen in on it as well. And the link is in the email that Tracy will forward out to you guys. So that was the last one. The upcoming one, which is actually tomorrow, is on the 55 filing. So again, I'm not sure I don't think that really is going to excite a lot of you there, but I know some it will. So just be aware, these are out here. We're putting these on. We've got a great legal team that is running these and provide a great deal of information. So I can get that link out to you guys that show the full calendar so you can sign up for any that, you know, might be of interest. And that's all I've got. So any questions for me?
Good job.
Thank you.
Thank you.
Thank you,
Thank
Jennifer.
you.
Yep.
Well, I appreciate you guys. And if any questions do come up, just know that I'm always available. Feel free to reach out to me, especially as you start to kind of go through some of the pieces I attached. Feel free to ask questions, but I will see you guys here probably in a couple of months, and we'll talk a little bit more in detail on the renewal for this upcoming year.
Hey,
Thank you.
Thank you.
thank you.
You're welcome. Have a good day.
Yep.
You too.
You want to take 5? All right, 5 minutes break.
Yeah, okay.
Can I order a pizza in?
Yeah.
Okay.
Thought you were gonna start bringing food to every board meeting.
She told me not to.
Crazy.
What? You're blaming it on me?
Well, Dale's not here.
Oh, all right.
Oh,
If you want, I'll bring, you want donuts, cookies, or,
I mean, it doesn't look like we need donuts.
Yeah,
no, really?
maybe some
How about
fruit,
apples, you know?
Yeah, all right.
vegetables.
We might even let you talk a little bit longer if you do that.
Oh, bonus point. Oh my God. I've been trying really hard to cut it down.
so
Really?
At the township meetings,
You know what the old saying, pull them out, like they play jingle. Bell.
yes, yes. Arthur Township times me.
our airport guy a list of companies that he should reach out to that have actually done runway resurfacing or paving,
Mhm.
because he went with a local, which I think is great. But I don't think that local has ever done runway resurfacing, so.
We could ask them.
Well, yeah, and we can do that. But the quote was $500,000, so I want to see kind of where
Oh,
That would be if I can
Well,
get some actual people in here that have actually done it before.
and they say a road's about $1 million a mile to pave. So
Yes,
that's
Wow.
about right.
Let's see.
is that regrinding it, redoing it?
Yeah, that's redoing the whole thing
So local from Mount Pleasant or from around here?
from here. Here in town.
we have a,
Equipment to do that.
I didn't think so. That's why I said,
Who?
these are a list of people that have actually done runways, and I want you to call them and see if you can't get a quote from them.
Who in town would even be able to do that? Who is the quote from?
Gamble's new place, Nick Gamble's,
Yeah, whoever's got the new
Gamble's
Gambles.
now.
Elmer's?
Oh, Elmer's can do it.
Can they?
Oh, Elmer's got the equipment to do it, yes.
All right. Well, we'll ask him if he ever
So I
has.
don't know.
Okay.
That's
I mean, I
concrete,
haven't
though.
I haven't got it in
Elmer's
paper,
have their
but that's what he
Asphalt
said.
plant. They have.
Oh, do they?
Yes.
Okay,
They do a substantial amount up around Traverse City and that
gotcha.
Okay, that's,
actually do good work. So you can, you know, they'll come in about, all three of them will come in about that, like
Right.
Will and. What's that one, Reese Riley.
It's Riley.
Yep.